In this video, we will be talking about your Pasteurella. As you can see in the image that is shown, it exhibits your bipolar staining. Pasteurella is named after Louis Pasteur. It is an animal pathogen, but it causes zoonotic disease in humans as well. It is non-motile. It is a facultative anaerobe and a gram-negative coccobacilli, ovoid filamentous, or is simply a bacilli. It is catalase and oxidase positive, and most importantly, it exhibits bipolar staining. One more thing is that it does not grow on MAC and are glucose fermenters. Again, what you have to take note here is that it exhibits your bipolar staining. The first species under Pasteurella is your Pasteurella multocida. So it is the most frequent isolate in the genera, and it consists of three subspecies. It's the Multocida, Septica, and your Galacida. It also has 5 serogroups from A to F. It comes from the Greek word multus, which means many, and sidus, to kill. So, to kill many. So it is found in the mucous membrane of URT and oral cavity of animals, specifically your cats and dogs. The disease associated with this is your pasteurellosis. So it is described to be painful, and it has redness, swelling, cellulitis, and purulent discharge following the bite or the scratch of an infected animal. This also known as your shipping fever when we call it as a disease in cattle. So it exhibits hemorrhagic septicemia. And lastly, one more thing to remember about pasteurellosis is that it has musty odor when grown in artificial media, similar with the smell of mushrooms. This is a summary of your Pasteurella multocida. It is gram-negative, it is Coccobacillus, it is a zoonotic infection affecting your soft tissue and your respiratory. It causes disease in humans as well. So, what causes the disease in humans is your three subspecies, your Multocida, Septica, and Galicida. It is encapsulated. So it has your polysaccharide capsule, capsular antigens, and your serogroups are 5, again from A to F. So this is a nice to know. Your A is for your respiratory infection, and your D is for your soft tissue infection or your cellulitis. We now move on to your Brucella. So the Brucella is a small facultative intracellular non-motile aerobic gram-negative coccobacilli or short rods that it is stained poorly when using your conventional gram stain, so you barely can see it. It is a category B by the CDC, and the mode of transmission is through aerosol. Therefore, it is handled with biosafety level 3 when you have to examine it. Your brucella is or can also be considered as an intracellular parasite. So it has an affinity to your reticuloendothelial system. It is also known to cause undulating fever, Bang disease, named after Bernard Bang, and Crimean fever, Cyprus fever, Gibraltar fever, your goat fever, and your Italian fever and Neapolitan fever. In this table, you can see some historical derivation. So these are nice to know facts, and some are really important. So for Brucella species, it is named after Sir David Bruce, who first recognized the organism as a cause of your undulant fever. Then we have your Brucella abortus. So, abortus meaning abortion or miscarriage. This organism is responsible for the abortion in infected animals. Then we have your Brucella melitensis. Melitensis is pertaining to the island of Malta, where the first outbreak was recognized by Sir David Bruce. Okay. And then next we have your Brucella sui. Sui, so it is a brucellosis in pigs, and your Brucella canis. So canis meaning for dogs. Brucellosis is a zoonotic disease that is caused by the ingestion of unpasteurized milk and dairy products. So it can also be caused by ingestion of undercooked meat or contact with livestock that are infected with the bacteria. So it has three stages. You have your acute, subchronic, and your undulant form and chronic. What you have to remember for your subchronic or undulant form that it occurs within a year of the infection and is characterized by undulating fever. It also has shown arthritis and epididymo-orchitis. While for your chronic form, it manifests 1 year after exposure with symptoms such as depression, arthritis, and your chronic fatigue syndrome. For the lab diagnosis of your Brucella, you have your Brucella agar, which contains casein. We have your Castaneda bottle. So this is put an underline in here or do a highlight in here. So Castaneda bottles. So this is used because it has your biphasic system. And then you have your gram stain. So it is a gram-negative intracellular existence. For your lab diagnosis, we can also use your abortus bang ring probe test. So you use 1 drop of hematoxylin stained organisms in 1 ml of milk agar. So the result would be agglutinated organisms in a colored ring. And then next we have your febrile agglutinins. This is the gold standard. This is the serological test for the antibodies in patient serum against the antigens of those who killed Brucella, of those cells that killed Brucella.